Well, let's go ahead and jump into it. I'd like to welcome everybody back today to Alabama Care. And we have the pleasure of having Ms. Katherine van Wyhe. And Ms. van Wyhe is the Director of the Legislative and Constituent Affairs at the Alabama Department of Mental Health. And at this point, I'd like to hand it back over. Ms. van Wyhe, if you would introduce yourself.
Absolutely. Thank you, Alex, so much for inviting me to take part in this morning's Alabama Care interview and for that introduction. My name is Katherine. I came on board with the Department of Mental Health in October of 2020. I serve in the Commissioner's office with Commissioner Kim Boswell, and I represent Commissioner Boswell and the leadership on behalf of the agency in my role as legislative liaison. Prior to coming to the department in October, I had served in the same role with the Department of Early Childhood Education for the past 3 years. It's been really exciting to be involved with state government and in public service and what I selfishly believe is the most critical and important role, and that is the role of people in human services, working in both education and health policy. And as Commissioner Boswell often says, the Department of Mental Health is quite literally about that, people. We are in the business of people, and this has been a really interesting time to come on board into this role, and that it's a role that I'm familiar with. I've really enjoyed working in state government and in advocacy for about 6 years now. I actually came to Alabama through a program called Teach for America, where I taught high school English and social studies in grades 9 through 12. So working both in the classroom as a teacher, then on the advocacy side for public education reform and expanding access to high quality education, and now with mental health. So the full continuum of care there.
Go ahead. I'm sorry I cut you off there.
No, please continue.
I was going to say that is quite a experience there, all the way from the classroom to dealing more with advocacy and legislation there. What exactly does legislative liaison mean?
That's a great question. So this is one of those areas where on the ground, as you know, you're going about your daily basis, you're probably going to interact with every single level of state government, from local to federal government and the laws governing that we're in, without even knowing it, whether it's driving on roads, going to the grocery store, putting on your mask, areas such as that. And in this role as liaison, I interface with all other state agencies here in Montgomery, in our state's capital, as well as local and community agencies that can include municipal governments, county commissions, League of Municipalities, as well as non-governmental agencies. So with the Department of Mental Health, that could be something like a community mental health center. That could be a concerned constituent calling about services in their area. And then also on the other side of that, that's interfacing with our federal agencies, including our congressional delegation, as well as the federal grant and application and review process for those funding streams that come to the department directly from the federal government. The majority of the services that, especially in the health industry, that are implemented on the ground level receive funding directly from the federal government. And so interfacing with our federal delegation to ensure those services continue and increase funding for different services. Our main priority, whether it's any state agency or the governor's office as well, who we work with, is preserving and increasing our budget for services so that we can bring those services back to the Alabamian. So you're not even aware that you're interacting with state government in your daily life. I think that is one of those areas where we are working kind of behind the scenes to ensure a seamless continuum of services, that we're able to take care of folks on the ground and ensure the best quality of life for you and your family.
So I'd like to say to everyone watching in the future that, when you think about the services that you're receiving, this is a huge part of it, is, individuals like Katherine and also Jill West and Commissioner Birchoff that we'll be speaking with later, speaking up on your behalf and making sure those services continue and advocating for you at the legislative level as well as the kind of contract and private business level as well.
Absolutely. And thank you for touching on that area as well, Alex. I think that's a whole other portion to this as well, as those public-private partnerships that are critical to ensuring that not only state government functions effectively, but also at the end of the day that we are accountable to you, the taxpayer, the citizen. And I think that's why it's so cool that state government is made up of us as well, so that we can advocate for our own self-interest. That's what government is all about.
Now, right now we are in a legislative session. Is that correct?
Yes, sir. We are on day 5 of legislative session. The 2020 regular legislative session convened last Tuesday, February 2nd. And as I'm sure everyone is aware, like every other aspect of our lives, legislative session looks different this year. The governor gave her State of the State address to a virtual audience this year, last Tuesday evening. And in the State of the State address, she provides, to go with the health analogy here, she provides a checkup on the state as well as the state of the economy and of the state of Alabama, as well as providing her priorities for investment in the year ahead and also her priorities for her policy agenda. We are very excited that under the leadership of Governor Kay Ivey, Commissioner Boswell, and our friends at the legislature, that investments in mental health have been a priority of this administration. Last session, again, under very different circumstances, but the state's coffers are in great shape. I really want to assure everyone of that. You will not be seeing cuts. Alabama was one of the few states in the entire nation that saw 0 cuts to our budgets last year, which is a huge testament to the very smart legal and accounting minds who work at putting together our general fund and education trust fund budget. So last year, even amidst the COVID environment, which was just beginning during the session, we saw huge increases in investments in crisis care and standing up the state's first ever 3 crisis diversion centers, expanding those services into rural crisis care, and continuing investments in the Stepping Up initiative, which is a county level initiative to decrease unnecessary bookings into jails and admittance into hospital emergency departments for those experiencing a mental health crisis, as well as school-based mental health. And that's one of those areas where I think all of us have been impacted this past year through the COVID-19 pandemic is, the very health of our mental wellness and well-being and our loved ones. And the governor and the legislature prioritized those investments last year, and we are looking to continue those investments this year. The governor outlined in her State of the State that additional funding for a new crisis diversion center has been added to her recommended budget, and that is something that we will be monitoring very closely and advocating for. The governor she takes her job incredibly seriously and knows that these are issues that are affecting constituents every day. She and her team are very aware of this, and we wanted to continue those investments, and we are very supportive of that, and we are very supportive of Governor Ivey's leadership in that area.
I've been very proud to say, I'm an Alabamian living in Alabama, and everybody that I talk with is I'm very happy with the way services have continued, that there's been no cutbacks.
And we know, thank you. We know that there have been so many disruptions because of COVID-19, and I really want to highlight our incredible providers and frontline workers and hospital and facility staff who have had to be flexible and creative and resilient in the face of true unknowing, and have ensured that services continue for individuals and their families in the community. So a huge round of applause for those workers who have really had to think every single day, okay, what's going to be different today? What are we going to do? How do we ensure that we are safe and continuing our services? Which is phenomenal and something we're very proud of. So thank you for highlighting that, Alex.
Yeah, and from a provider standpoint, we always want to make sure the team is safe, our team is safe, but I feel like we have the backing of the state and of the system there. So the resources have been put behind. I kind of want to talk about the legislative session almost in years past and moving forward. What does that look like? Is it actually going to Capitol Hill? And
that is a great question. And so traditionally, one of the really cool aspects of working in this role, and also as just a citizen in Alabama, is that the State House is the people's house. This is your place to engage with your representatives, whether it's by yourself or with other members of your constituency, to directly meet with and bring up issues and highlight your concerns, and also bring solutions to the table that your representatives are eager to hear and represent their own district. In years past, that has meant you can physically come to the State House. Here you can schedule a meeting with your representatives and meet with them. And when I refer to representatives, I mean both your House of Representative members and your State Senate members who represent your district. And again, they are accountable to you. And this year that has gone all virtual. And so in order to ensure that we still have public access, it is the people's house, and that business can proceed as normally as it can under the circumstances. They have limited public physical in-person access to the building. And as many of us have gotten used to, it's turning on your camera and going on Zoom, picking up the phone. I think there are areas of this that have really actually increased access to the legislative process. And just like all of us have experienced, there have been some hiccups as well. We're still, audio and video is streaming from the legislative session, so you can see the committee hearings, you can see what's happening on the House chamber and the Senate floor through the audio and video links for the legislature. And of course, there've been some hiccups, but we're all in this together and we're all working on this together. So what that looks like this year is, again, they convened last Tuesday. They're coming in for 2 3-day legislative weeks, which means that they are on the floor doing the people's business, receiving and passing bills Tuesday, Wednesday, Thursday, with committee meetings, and that's where bills are assigned to individual committees dealing with subject matter, meeting on Wednesday, and then they're going in on the floor of the legislature on Wednesday evening, afternoon and evening. Whereas traditionally Wednesday is just a committee meeting day. And that's usually where we would see a lot of our advocates and lobbyists in the State House, because Wednesday is a really great day to engage your member both in the committee meeting process, if there's a bill or a package of bills that you're following, and to meet with them personally and schedule those sorts of events. Usually those would happen on Wednesdays because the committee meetings are scheduled in advance. And so most of that has gone virtual, but I do want to highlight the opportunity if you are interested in personally engaging with your legislature and you feel that you can do so in a safe way, masks only. You've got to schedule through their assistants. All of that information is available on the legislative website, and they do have special meeting rooms set aside with social distancing, with sanitation and tables and chairs that are set aside where you can meet with your legislature in a space that is safe to do so.
What does that look like? Is it 5 minutes or is it 15 minutes? And is it kind of one-on-one, or is there a bunch of people in the room just kind of shuffling through?
That is a great question. In the meetings that I've been engaged in so far, in order to maintain that social distancing, it is limited to 15 minutes at a time because those are the CDC regulations. And based on the room size, it can be just you and the member, or there can be up to 3 or 4 other individuals in that room as well, which is as much as you can keep safe in that area. And also from a legislative standpoint, I think that's also kind of the group size that can be most effective for having a meeting of that sort. So you can still engage in that way. You can also schedule a Zoom or a virtual hearing. I've had members who are doing FaceTime during committee meetings. If you'd like to have a public hearing or engage on an issue, they're tech savvy and using an iPad or an iPhone for FaceTime as well, which is kind of fun to see how we're rolling with this. And it's neat to see how some of these areas of accommodation might be useful beyond COVID in order to encourage that public access and engagement with the process. Next week, they will be going on a recess for a week, and that will allow us time to assess what's working, what's not working, what do we need to fix, and ensure that any members or staff who need to do so have the ability to quarantine and remove themselves from that physical setting without disrupting the process.
Now, I feel like you can advocate year round. You can really get in touch with your representatives year round, but we're kind of at a crunch time right now when it can almost be most impactful. And so you mentioned that Wednesdays are kind of the best day to meet with our representatives. And there's only so many weeks that they're in legislative session.
That is correct. Mm-hmm.
And how many representatives are on the Hill?
That's great. That's a great question. We have 105 representatives and we have 35 senators. And both your representative and your senator will represent your district. So you've got 2 representatives there in the State House. Again, Wednesday has always traditionally been the day that I recommend for advocates to visit because you have the set schedule of committees. Well, my member has a committee at 8:30. That's about health. It's got a couple bills that I'm interested in. I can sit in on that committee and then arrange with this assistant to meet with him or her afterwards directly related to that issue.
Now, do you try and meet all of the representatives? Is it 140 you said there?
104 representatives, 35 senators for a total of 140 legislators. Yes, sir. And that is also a great question. From a state agency level, again, our number one priority is preserving and supporting our budget and the governor's budget request. And so we are focused on those committees that specifically, again, from my standpoint at a state agency, focus on those committees that deal with the budgeting process and any bills that impact the agency, specifically related to healthcare. Here's an example of a time where it's not exactly set in stone. Several of your viewers may be familiar with the gambling bill that has been talked about for a really long time. The governor pulled together a commission of professionals last year to study the issue. They presented their findings to the governor late last year, and Senator Del Marsh, who's from the Anniston area, dropped a gambling bill. Dropped is the word that we use when it's filed in the system yesterday. And part of the revenue that will be generated by gambling, if this is passed by the people of the state of Alabama, will be earmarked for mental health. And so that has been assigned to the tourism committee. And so that is going to be an issue that I'm monitoring, even though I never would think that I would have an issue coming up in tourism. That's where that bill has been assigned. And because it directly impacts not only the Department of Mental Health, but the services that we provide, we're going to be monitoring that issue and working with other stakeholders engaged on that issue.
So you kind of reverse engineer that. You follow the bill, see what committee it's in, then find out the representatives on that committee and kind of focus on them.
Exactly. That's a great way to put it. You're not only going to be engaging the members of that committee, but also the sponsor and co-sponsors of that bill. Obviously, you'll have several of the same familiar faces. They are representatives as do we all, pursue those interests that are of specific importance to them, their constituents, their background. For example, we recently saw that a bill impacting subsistence pay, which is kind of like overtime pay for security officers, passed through the House yesterday, which would include mental health and our security officers that work at our facilities. And of course, that bill was brought by a former law enforcement member, Representative Pettis, who served over 25 years as an Alabama state trooper. So knowing your members, their background, their passion areas, areas that they're engaged in their district is also really critical for just building relationships. This is all about relationships at the end of the day.
I think that makes a really good point. I mean, you don't want to go in there. Let's say an individual or a family wanted to speak with their representative down on Capitol Hill. You don't want to go in there kind of bullheaded and say, this is what we need. And you definitely want to express your needs, but it is a relationship. And I really enjoyed that you touched on that. You want to get to know your representatives. They want to know that you've taken the time as well to invest in them.
Exactly. And it all goes down to, we're all people. We all are driven by our passions, our interests, and the phrase of walking a mile in someone else's shoes. And that's the critical importance of that one-to-one personal advocacy. Sharing your story, sharing your background, creating those common points of connection, and helping educate your own members on issues that are happening in your district, whether it's your county, your school, your city council. They will already be engaged on some of these issues, but they can't know everything. And so you get to serve that really critical role of not only being an advocate but informing and educating on those issues. I've always firmly held that advocacy is all about education. And so being able to share your story, being able to not only point to the issues that you care about, but also bringing solutions to the table. They want to hear directly from their constituents, those who they are held accountable to, on unique solutions that work for you and that work for your area. We know that there's no one-size-fits-all solution for any issue. And so bringing together diverse viewpoints that are representative of the community in which you live, in which you work, in which you serve is critical to ensuring that state government works for you.
Yeah, and I think you hit the nail on the head there. Is these representatives, they want to get involved. They are passionate, yes, but it's tough for them to know everything. And for your own situation and my own needs, it's almost, I read somewhere, it's like, if you're starting a business or you have an idea, there's nobody that is as excited as yourself. And just because other people don't get as excited doesn't mean that they don't like the idea. Maybe they're just not informed as you are. So you have to show other people what the problem is or what the challenge is, and then provide that solution. I really like how you said, don't just come and say, this is wrong, we need more of this. Well, they're also looking for input. Okay, that's great, but you know more about it than I do sometimes. So what is the best solution here? So it takes time. If an individual or a family is looking at going down and advocating, take time and think about what that solution looks like so that the representative has that ammo to go into that next committee meeting with. It's almost like arming them with information. Exactly.
And I think that was very beautifully put, Alex. You are an asset in their toolkit, so to speak. And for those advocates who consistently engage their members, you then are able to serve as that resource guide for your member on that issue. Whether it's a specific provider, a specific issue relating to mental health care, behavioral health care in your area, unique challenges and opportunities that are in that member's district, you then are identified as the point person for that, which is a really cool role to play. And I never want folks to be, scared to engage their member, because they are there to serve you and your neighbors, your family. And that's a really cool role to play, where you can be as engaged as you want on these issues. And that's where I know that when we really have those boots on the ground who are informing policy, that's going to be effective policy. Policy is only as good as it's put into practice. And when it's driven by issues that are actually local and, kind of organic to the ground, so to speak, that that's going to be effective from the statewide level. Thing that's going on in all 67 counties, we rely on you to be able to share those stories with us, and so we can work together to craft policy that actually works for you.
Now, at the legislative session, what would you say is the percent population from, let's say, individuals that are coming from their district rather than people that are kind of, I don't want to say in the system, but are used to the process? Would you say it's like 20% of people that are first timers or 50-50?
That's interesting. And I'm not sure if I could provide you a percentage breakdown, because it varies so much on day to day and the issue, kind of the hot issue at the moment. We know that many of our associations and organizations, in any group can also, pay to have a paid lobbyist or representative who represents their issues, usually someone who's based here in Montgomery and is able to kind of spread the impact of how many members you can engage on specific issues. And it also is, regarding the bills and matters of interest that are before the legislature. We know right now, obviously in these first 2 weeks of session, really tackling the COVID pandemic head on when it comes to immunity for businesses and our providers and schools, as well as ensuring that Alabamians don't have to pay income tax on any stimulus payments that they received or, that businesses received last year. Those are the really hot issues these first 2 weeks of session. So you're hearing a lot from the business community, from small businesses and employers who are really eager to ensure that they have that immunity. That bill was passed by Senator Arthur Orr, as well as, the income tax, ensuring that we don't have to pay income tax. That's where you're going to see a little more state agency involvement with our friends at ADECA and Revenue, who have been monitoring those payments as well.
Now, what is something, if you're talking with an individual or a parent or a family, what is something that you notice that representatives catch on to quick that you would recommend someone advocating kind of mention or go in that route?
I think first and foremost, the foundation of any relationship is trust and honesty in forming those connections. Being able to share a personal story of self, maybe doing some research on your member, where they went to school, their background, as well, so that you're able to form these connections that, trust and honesty and integrity in those relationships. So you're building a solid relationship from the beginning, and just sharing your personal story. I think you don't worry or don't be intimidated about not knowing, that national policy or, a legislation that was passed in Congress. And at the end of the day, I remind folks, yes, what's happening on CNN looks really cool and can, get our blood pumping. But at the end of the day, it's your city council and your local school board that have more impact on your daily life. And so sharing your personal story and really driving it home, that local connection and that impact. How does this impact your member? What is your member's stake in this issue? How does this impact your member's business that they're able to conduct in the State House, whether that's the committees that they sit on, any bills that they've sponsored? So really making it crystal clear, that connection and the role that you serve in being able to provide information as an advocate for your cause. So identifying your cause and exactly what you're there to speak about, and the solution or the identified issue that you can bring to the table.
I like how you mentioned that the news can kind of look a little out there or far from home. But no matter what I see on CNN, I still wake up, I still have my tea, my neighbor and I talk, and us as a small community here in McCalla, we can make a difference in our community. So it doesn't feel out of touch at that point, knowing that, if we get together in communities, we can really drive what we want.
Beautifully said, Alex. Thank you.
I have a question. Is there, how many years have you been with ADMH? You said 6?
I came on board with mental health in October of 2020. I previously was with another state agency for 3 years. So I've been almost now 3.5 years on the state government side. And prior to that, I worked in private contract lobbying for about 3 years. So I've been on both sides, both the lobbyist side and state government side.
Is there a success story about advocacy that really sticks out for you in Alabama in the past few years?
Oh my goodness, that is a great question, and I love being able to highlight these stories. One of the first issues that I really became engaged on was public charter school law in 2013 and 2014 that would expand access to public school options to more students. And we had an advocacy day rally that was organized by multiple partners. That's what's so cool. There was such a diverse coalition of partners engaged on this, and brought nearly 3,000 parents, school-aged children, teachers, and other school advocates to Montgomery to march down Dexter and demand change for public education in Alabama. And it was so cool to see, you know, parents and teachers and school-aged children sharing their stories with members. That this is why I love my school. This is why I've been able to attend this school, whether it was through, you know, a scholarship of some sort. And also kind of, you know, those stories that really drive you to pursue action of, you know, I know that this school is not my best fit. I need these additional services, but I'm not able to get that now. And it's you know, to hear the stories from the individuals who are most impacted by this themselves. On another issue, so that, you know, on that side of it, on another issue from the state government side, I'm very proud to have worked with the team at the Department of Early Childhood Education and Governor Ivey in securing the state's largest ever increases in funding for the state-funded first-class pre-K program. And that was driven largely by the efforts on the ground of teachers, parents, school administrators, superintendents, mayors, county commissions wanting more first-class pre-K program in their area because they saw how much better those students were prepared for kindergarten and how many more parents they were able to engage in the workforce. So that was another really cool issue in engaging not only on the local level, that grassroots advocacy, but also the business community and what some might see as, you know, unlikely partners in really demonstrating that everyone benefits from the value of quality public education. And so having those individual stories told and also having the data to back it up, having data and outcomes that showed your investments are paying off for the state of Alabama is huge, showing the value of that dollar when you're making the case for an increase in investment.
Yeah, I like how you say an investment there because it is a return on the dollar.
Exactly.
I think that's something that us as a disability community can really stress for the government here in Alabama with our FMAP. And, you know, for every dollar we spend here in Alabama, we get so much from the federal government. And a majority of that, those services are distributed here in Alabama and that money stays in state.
Exactly.
You know, that's not really going to out of state stuff like that. People aren't finding out. A lot of that community stays in state and that revenue stays in state, which then comes back for the local government. And I love that you highlighted walking down Dexter there, 3,000 people. That is powerful.
Yes, it was incredible. It was incredibly powerful. There's not only the power of numbers, but also standing in solidarity. What does that look like? And having such a diverse coalition of partners. I think that's an area where advocacy is such a crucial role in not only helping to inform policy, but holding government accountable. And I'm always a very strong supporter of, you know, it can't, you know, not just having you in the room, but being able to share those opinions and representative of the community at large. You always have more supporters than you think. And it might be finding those areas of whether it's commonality on an issue, where you'll be surprised at how many folks are willing to join in hands with you.
Yeah, so Alabama Care community, you heard it first. We got our benchmark at 3,000. So it's not going to happen this year, but everybody get their vaccine and we'll look at next year of going down as a community and expressing our needs alongside great people like Mrs. van Wyhe. And we're going to kind of wrap up here, Mrs. van Wyhe, and we are going to introduce Mrs. Jill West and Commissioner Burdeshaw in a few minutes. But before we let you go, and I appreciate you spending time with us this morning, is there anything that you would like to say to individuals or families about the legislative process or anything in general?
Thank you, Alex. I think I really just want to highlight to not be intimidated or scared. They are your members, they represent you, and they represent your community, of which you play a vital role. You are, you know, the network of your community, your friends, your family, your neighbors, your businesses, your schools, your churches. You are what makes the community. It's not government. It's not a bill. It's not a piece of legislation. You are what makes the community. So never be scared to reach out and tell your story. They represent you. They want to support you. They want to be able to represent your best interests. They don't know about it unless you tell them.
So speak up.
Absolutely. And don't be afraid to do so. That is the wonder of, 2021. Call and leave a voicemail. If that's not something that you're able to do, sending an email, all of these sorts of things, sending a hard copy letter. I get those as well from constituents all the time. And sharing your story with your members, it's incredibly valuable. And I cannot emphasize enough how much those individual personal stories impact the decision-making process. That members will reference a specific conversation or an event or a meeting that they had that was impactful in determining the process.
It really is giving them the tools to advocate for you. And I think during this time, maybe they're a little bit more open to the online media. So if you're at home and you have just a phone, go ahead and just put it on and start recording and talk about it. And then go ahead and email it, post it on YouTube and share it that way.
That's a wonderful suggestion. Thank you, Alex. Yeah.
Well, is there anything that we haven't talked about that you'd like to say?
Goodness, I feel like I've been talking a lot. Thank you so much, Alex, for the invitation to take part in this event this morning. I'm going to share my information with you. Please feel free to share that. That is public. Again, I serve you. I serve the constituents. Please do not hesitate to reach out, no matter how small, no matter how big. I'm here to work with you and to ensure that you and the individuals in the community are able to get the services and the resources that they need. And just, there again, nothing is too big, nothing is too small. There's no such thing as a silly question. So please feel free to share that information with your community as well.
Yeah, no, we're blasting out your email on all the
there
platforms.
You go.
Cell phone number, emails is all going to be out there.
There you go. Yeah, it is public on the website, but please feel free to share it so it's much easier for your folks to access. And again, thank you so much for the opportunity to meet with you today, even virtually, for this interview. I've really enjoyed it. And please don't hesitate to reach out if you receive any questions from the community.
We appreciate that. And you have a great rest of your day and keep fighting the good fight.
Yes, sir. On to committee meetings. Thank you.
All right. Bye.
Bye.
Okay. We are going to bring in our next guest here, and we're going to talk a little bit more about some strategy, and not necessarily some strategy, but what's some agenda this year for ADRS. And I am going to go ahead and bring in our next guest here. And it may take a few seconds to get our mics up and running and our video on, and then we'll do introductions. Hello.
Hello.
Can everybody hear me?
Yes, I can hear you.
Perfect. Commissioner Birchoff, can you hear us?
I think you're muted right now.
There we go. I'm off.
There we go.
Hey, Alex, good to see you.
Good to see you again. It's been about a year and a half, I think, since we were down in Montgomery together.
Yeah, it's crazy times. I know. So I'm going to give a quick introduction, and then I'd like to hand it back over.
Today we have with us Commissioner Jane Elizabeth Burdeshaw, and she is a commissioner in Alabama Department of Rehabilitation Services, and Mrs. Jill West. And Mrs. West is the Government Relations Manager and Director of Office and Communications and Information at Alabama Department of Rehabilitation Services. That's quite a title. I got to say, I need a little sip of water after that one. But I'd like to hand it back. I'd like to hand it back over, and we'll start. Commissioner Birchoff, if you would introduce yourself.
Well, good morning. Thanks, Alex, for having us to talk a little bit about the Department of Rehabilitation Services and all of our work in the legislative process. And I think Jill's going to start us off with a little introduction or answer any questions that you might have. And Jill has been a fantastic introduction to our department in the last year. Jill comes to us with a vast amount of experience in the nonprofit world. And so we're just thrilled to have her with our state agency.
Mrs. West, go ahead and take it away.
Thank you very much, Commissioner. I appreciate that. It's an honor to work for such a compassionate and a hardworking agency. It is my first bout with the state government, and it's been a very good one. And I do feel like a lot of the nonprofit experience I've had leading up to it has absolutely helped me, particularly in the relationship building part that Ada Katherine mentioned. I couldn't agree. I thank you, Alex, for inviting us on and for being able to follow Ada Katherine, because she did provide an enormous amount of information that that we share as far as advocating for services in the legislature. So I don't have to repeat a lot of that. That also outlines the important partnerships that all of our agencies have. I heard once in one of my prior jobs when we worked with national organizations that Alabama is one of the few states that has such strong interagency cooperation and partnerships. So that is something definitely to be proud of in Alabama, that whenever one agency maybe can't provide something, they partner with an agency that can, and needs are provided for. And there's absolutely a very strong relationship we have with the Department of Mental Health.
Yeah, it's very I don't want to say intertwined, but very strong there. And I've been in the community for 4 years from a provider perspective. But it almost seemed when I was first learning that ADMH and ADRS kind of followed one another on the same letterhead, and I didn't know the difference. But they are two separate entities. And if you could kind of explain that to somebody that might not be familiar with that.
Absolutely. The Alabama Department of Rehabilitation Services, it provides services for all ages of Alabamians with physical, mental, developmental, intellectual disabilities. So it's a very broad array of services that we provide at every age, beginning with our early intervention program. We have 4 major programs. The Alabama Early Intervention System, it provides services for children from birth to 3. And we have our Children's Rehabilitation Service, which provides services from birth to, I believe, 21, and Jane Elizabeth can correct me if I'm wrong with that.
That's correct, 21.
Okay, 21.
Unless you have hemophilia, which is a bleeding disorder, and then we serve you all the way through adulthood.
There you go. And then we have the Vocational Rehabilitation Service, which serves any age, adult age, in and also teenagers. And it serves the many ages that are working toward increasing their education, obtaining a post-secondary education, job training, and job placement. That program also has multiple sub programs. One that's very important to us, the Business Relations Consulting Program, which works directly with area businesses and helping them prepare to hire people with disabilities in whatever they need, whether it's accommodations, their understanding of the ADA, and even staff and leadership training on working with someone with a disability. So that's been very successful. And then we have our SAIL program, which means the State of Alabama Independent Living and Homebound Services. And that also provides services to adults well into the senior years, and those who have a harder time, more significant disabilities that keep them at home, keep them bedridden, and want to improve their independence in life. And that has been a very successful program as well. There's so much more I could talk about with ADRS, because it just is a huge gamut. The mission is to enable Alabamians with disabilities to reach their maximum potential. We're going to enable them to do that. So it's a very empowering program that I'm proud to be a part of.
And I'm going to kind of put you on the spot here. About roughly how many individuals does ADRS serve?
Oh, heavens. Like Ada Katherine, I've been here for exactly 1 year, so I'm still absorbing numbers, but I'm sure Jane Elizabeth can answer that question as well. A ballpark figure, she's been here for a very long time, worked her way up to commissioner, so she knows more about this agency than anyone. I do, before you pass it over to Jane Elizabeth, want to mention, going back to the partnerships and the interagency partnerships, there is a new website that was recently launched, and you're probably seeing lots of ads for it, called alabamafamilycentral.org. Ada Katherine and I were both in on the front end of developing this website with all state agencies that serve families. So this is a central place that anybody can go to and be directed to the proper agency. It's very simple, it's easy to navigate. There's phone numbers and connections that are made, and we're constantly adding more services to that website. It's managed by the Alabama Partnership for Children, and they've hired a full-time person to manage that website because it's already being hit a lot. So we want to make sure that people know about that, alabamafamilycentral.org. It will point them to all of our services, and our website is rehabalabama.gov. It's a new website, easier to navigate, very mobile friendly, lots of video, and we have a new blog so that we'll keep people updated on the latest news and news releases as we post them. So I wanted to make sure I mentioned that about state agency partnerships and how powerful that can be.
Yeah, we are going to put alabamafamilycentral.org into the chat so anybody watching can have that link for later. And I love that idea because I feel like sometimes I'm looking for an answer and I'm not sure who to ask. So I have a long list of people to call, and then it may take a week or two to hear back and then kind of go from there and find out who I'm really supposed to be talking to. And that Alabama Family Central sounds like kind of a central kiosk that anybody can go to anytime. It's online, and kind of navigate that. And it's that kiosk, that website will kind of direct you where you need to go there, and what that contact information is.
Exactly. It's been described as a clearinghouse ultimately for programs in Alabama. And it's not just state agencies, but other programs that are partners with state agencies that can serve about any need that they have. I think right now, particularly with the challenges of COVID-19 and so many schools either being in session, out session, people trying to homeschool, there are lots of agencies trying to provide services and support for families in that way. So it changes, based on what the need is we'll make sure that we're highlighting services that people need at that time.
Mm-hmm. Very cool. And I'm going to ask a question here, relationship building, and this may be a good segue here, but Katherine mentioned relationship building, also advocating, and then she also mentioned the word lobbying. And so what is that? How does that work together? Advocating versus lobbying.
I'm going to jump in. We as state agencies cannot lobby. We can educate legislators about our services. Lobbying is for private industry with lots of money. We share and advocate for our services. We try and do that through our partnerships with other agencies. If we have a similar message that needs to be taken to the legislators, particularly if we can also involve those nonprofits and families and individuals with disabilities. There's been many years where I've gone to the State House. We can't do that this year like we normally do, but we gather groups of folks and we just take our message to the State House. We explain what the needs are and why those services are important. Hopefully our message is heard, and typically it is.
I think that's really powerful to have the individuals that are being served go with you, and them to have one-on-one time with those representatives.
Right.
It hits a lot different than reading an email.
Yeah, the commissioner's absolutely right. I've, again, working in nonprofits my entire career, I've never lobbied. The point of what we do with government relations is building the relationships, building the trust with our lawmakers so that they know what we're bringing them is factual, is what is absolutely needed, so they can make informed decisions on policy. We're also really the liaison between our consumers, the people that we serve, their needs to the legislator, because that's really what they want to hear. ADRS serves in every legislative district in Alabama, so we can bring them real stories of families within their own district that are benefiting from ADRS services and why it's important to maintain that support of them.
Now, do you notice, even though we can speak with our representatives throughout the year, is right now kind of crunch time where you speak with representatives quite a bit, or do you notice that happens more throughout the year?
Effectively, it works throughout the year. It's maintaining those relationships, particularly with the committees that you'll work closely with, the members of leadership in the legislature, so that you're kind of always informing them as things change and needs change. That way, when you do get to crunch time, when the legislators have the ears of everybody at one time, they're already familiar with your programs, and they're kind of already familiar with what you're going to be advocating for that legislative session. So it's better for their memories. It's better to always be leading up to the information that you need to share.
Yeah, it reminds me of like a year-long program or class where you're continuing to educate, but then at the end you have a final that, you know, this is the end, this bill is going to pass, or, you know, you kind of got to take them over that last little hump during this legislative session. And speaking about this session now, is there anything that ADRS is really focusing on and has a specific agenda for?
Sure. You want me to take over, Jill?
Yes, please.
Okay. Well, obviously, every year, budgets are the primary concern of our legislators. We talk about all these, you know, bills and different efforts, but the budgets are what they're required to pass, the Education Trust Fund and the General Fund. And ADRS is housed within the Education Trust Fund. Two of our programs, our largest program, the Vocational Rehabilitation Program and our Early Intervention Program, are actually funded directly out of the U.S. Department of Education. We have direct ties to education across all of our programs. And so we're housed there, and that's the discussion we're having throughout the year with legislators. Most of our programs for the last several years have been financially sound. We receive enough federal and state funds. We receive about 80% federal funds, 20% state funds. We have to have those state funds to draw down those federal dollars. But most of our programs are okay. We have one program, though, that it continues to grow leaps and bounds. And that growth has caused us to need additional income into that program from the state legislator. And that program is our Alabama Early Intervention Program. We are the lead agency for a large system of care, and we have more and more kids, infants and toddlers birth to 3, who need our services. And more people are finding out about our services, and that's great because we need to serve those kids. The problem is we've got to have the money to serve them. And so for the last several years, that has been our primary effort, is to make sure that we can get through the year and not go in the hole for those services, because it is an entitlement program. What does that mean? That means if someone is eligible for those services, we as a state are required to serve them. And so if we don't serve them, we can be sued. And we don't want that as a state. So we continue to educate our legislators and the public about our needs there. We have an additional request of about $1.49 million for the early intervention program. That would serve an additional 311 children for 12 months. And that's about the average growth we're having every year for the last 6 to 7 years. And so that growth is down a little bit with COVID because it is an in-home service, but we expect about 311 additional children in that program this year. That 1.49 million was in the governor's recommended budget. So that's a great jumping off spot. Now we just got to ask the legislators to hold that money there that the governor recommended and get it through the budget process.
I have a few questions on that. Why do you think there's such a big growth of 300 children a year over the past 6-7 years? I'll start off with that one. And then the other one is, it's birth to 3. What exactly does that look like for a family that would be receiving those services?
Okay. The program serves children who have developmental delays or who have a disability which could lead to a developmental delay. So for instance, a kid who's been diagnosed with Down syndrome may not yet have a developmental delay, but because of that diagnosis may develop a delay later in their childhood. And so, or you may have a child who doesn't have any diagnosed disability, but is not speaking at the rate they should learn speech. And so all of those services are provided in what we call a natural environment. What does that mean? It means that we go into a home or into a daycare, into a setting that that child is used to. So for instance, if a child is having trouble standing or learning to crawl or learning to walk, parents are the best teachers. And so we want to equip the family to use the things within that natural environment to help that child learn and develop and grow. So for instance, if that family has a coffee table in the middle of the den, we want to sit down with that child and that family and help that family learn how to use that coffee table to help that child pull up and learn how to stand. And so it's a great tool. It's evidence-based practice. And so it's a wonderful program. Now, why is it growing? One, it's growing because families and pediatricians particularly are learning about our services. And so the more people know about that service, the more families that have always needed us, they just didn't know we were there, are finding their way to us. Another reason is that through the years, we find out more and more about disability and the needs of children and families. And so originally, when early intervention started, that program only served a handful of disability groups. Now we have about 240, I believe, some odd disabilities that automatically are eligible for early intervention services. And so we have a larger pool of kids and families that we can see. So I'm not sure that's all of the reasons we're seeing the growth, but that's a pretty good start to explain it to you.
Yeah, and if you don't mind me asking about how many children are in that program being served by that program this year?
It depends on the year, but we are serving, I believe, over 8,000 infants and toddlers per year now.
And if you had to put a projection on it, I know this is kind of out there question, but how many children in the state of Alabama do you think should be receiving that service?
Oh goodness,
I know.
I would need to do some research there, but I know there are more kids that need us. I know because I get the calls. I know because Alabama Family Central was needed, a website to help families find their way to us. You're not the only person that comes into Alabama and realizes that there's this really intricate web of services and they're wonderful, but people have to navigate that. And the Children's Cabinet from the governor's office knew that was a need. That's why Alabama Family Central was created. And that's why we continue to need to get out, educate the public about who we are and what we do. And we need families to tell other families. We've done a really good job in the past few years of trying to create more and more programs like our parent consulting program within our children's service. We've now created some of that family to family connection within our early intervention program. There's nothing more powerful. I'm just a bureaucrat. There's nothing more powerful than a family seeing another family in a hospital setting and saying, hey, do you know about this program? Let me tell you about it. And so the more we can get word of mouth, the more we'll grow. The problem is, as with growth, we've got to have more money to serve those kids. And so I want to do both. And I think we can, and we have in the past few years.
I love how you say, really touching on those first doctors and then the family support and the peer support within the families. I think those are great catalysts for that rise and getting into contact with those families that need that service there. And when you describe early intervention program, it makes me think of coaching. Going into the location and kind of coaching the parents on the things that their son or daughter needs and how to get that, but coaching them up and empowering them in those sessions, and then kind of stepping back and letting them take on from there, because they're going to be with their child for a long time and you want to hit them early.
Absolutely, particularly with kids. Let's take autism, for instance. If a therapist comes into a home and they're only there an hour that week, I'm not saying they're not doing any good. They're doing a great service. But what about the 25, 30, 40 hours more that a parent could be doing the same kinds of therapies with that child throughout that week? And so the child's going to develop so much faster with the help of those family members. Plus, the child's going to respond more to someone that they love and they're familiar with. And so it's a wonderful program. I can't advocate it for it enough. There are other programs within early childhood that are similar in nature that treat parents as the first teacher. And we've got to equip parents to be able to provide those services within the home.
Yeah, and the parents as the first teacher, I think, is a great way to put it, because you are. even if you don't recognize it. But you are that child's first teacher there. And it seems like such an easy thing for a representative to be like, yeah, that makes total sense. If you take into all accounts of the investment, investing early and the return on that investment for that individual long term, with the
Well, if I can jump in, the governor talks about strong start, strong finish. And we talk about pre-K services within our state. And we talk about, all kinds of services. The more we can get to those families and those kids early, the better chance we have for good results in the end. And early intervention is the very start. When we say birth to 3, we mean birth. Like, we literally pick up kids as they're exiting the hospital. And so, and then on their 3rd birthday, they are transferred from our family service plan in early intervention to what is typically known as an IEP, individualized education plan, within the education system. And we want to provide the services that are necessary so that when we transfer them on that 3rd birthday, that they are ready for the educational supports that are available to them within that system.
Now, when you're advocating for early intervention on Capitol Hill, what does that look like? What kind of information are you bringing to representatives?
Well, we're bringing the number of children that we're serving, the types of services that we're providing, the fact that it is an entitlement program, explaining that to them and what that means for our state. And then we're talking to them about a simple request. I try and make any request that I give very, as non-complex as possible. The request is simple. I need to serve about 311 more kids this year. It costs me about $398 per month. And if you multiply that times 12 months, that's 1.49 million. It's a pretty simple request. Either we can do it as a state or we can't. And I think that we can and that we will.
I like that you simplify, because just hearing that now, I walk away from that with, we need 311 more kids served and 1.49. Got it. I can go into that committee meeting knowing that that's what's being asked about. Is there any reason that it wouldn't pass for an increase?
Well, as you know, there are multiple state agencies and there are many, many needs in our state. Whether we talk about the prison system and all that's going on with the federal government coming in and talking with us as a state about our prison systems, whether it's about mental health treatment and crisis intervention needs, whether it's homebound services and waivers. We have 5 waivers within the state, Medicaid waivers. One of them is housed with ADRS. Some are housed with senior services and some with Department of Mental Health. All of those are needs. We want more kids in pre-K in our state. Again, another need. All of these are important, and we only have so many tax dollars to go around. And so every year, everyone is saying and shouting, these are our needs, these are our needs. And you're coming from whatever perspective, where you sit is what you're going to advocate for. And so, we just have to take those competing needs, talk about them. I'm advocating for some of those that don't impact ADRS, just from a personal perspective. And so how do we balance all of that? How do we take the tax dollars that we have and use them? I do not envy our state legislators. They have a hard job. The governor has a hard job. They have to take all of that information in and make solid decisions for the future of our state and families. And, the best I can do is just educate them about the specific needs that relate to the folks that I serve, and make sure that those needs are met.
It's got to be extremely hard for representatives, because there's not one bad answer there. It's like, yes, you want to help. Everybody wants to help these individuals or, get these services out, but that's got to be a hard decision to make.
The key for me, Alex, and I'll just be honest, is to make sure that people know that the Department of Rehabilitation Services is being good stewards of their money. Mm-hmm. If they give me $1, I want to show them how I'm spending that dollar. I don't know if everybody does it that way or not, but for me, it's extremely important. I want to make sure that our budgets are tight, meaning I don't want to over budget. I don't want to pad budgets. I want to get what I need and I want to provide the services that are needed. And if I do that, I can build trust with the individuals down at the State House so that when I do go with them to talk with them, there's not a lot of noise. It's just a simple message, and the relationship is built and the trust is built. And then hopefully there's enough money there to make it happen.
You answered the question I was going to ask is, how do you cut through the noise? And, and that would relate back to individuals and families that are looking to advocate on their behalf too, is keep it simple. Show exactly how these services are impacting your daily life, document it, and build those relationships. Speaking about that, what can we as a community of individuals and families do to help you guys further that advocacy effort right now during this legislative session?
I could take that. We absolutely want people to be informed. There are many ways to easily find the information, including our website, rehab.alabama.gov. And then once they're informed, to talk to their local legislators, whether it be sending a message through social media. I believe all of the legislators have a Twitter account at this point. You can follow them on Twitter and send them messages that way. Believe it or not, they are following and responding to some of those messages. Simple telephone calls to their offices. You can find all their contact information on the Alabama legislature.gov website. Many ways to do that, but just tell their stories. I know that there are so many families out there that are just learning about early intervention. And they might be concerned that the money wouldn't be there or the ability for them to be referred might not be there. And I think if they're expressing those needs and those services directly, we do our best to gather those stories as well. We know families, we have people on the front lines working with families every day. So we try our best to share those stories with our lawmakers so that they're very, very well informed. As well as the statistics, the data that is behind that. It's all very evidence-based. It's all measurable outcomes. And as Jane Elizabeth said, and this is what I respect the most about this agency, is we don't ask for more than we need. We absolutely go in with a very simple number, and that's backed up by the data, to say, we must have this to continue this fiscal year and to be able to serve the children that are going to be referred to us. And by law, we are required to do that. So it is a very simple message. We're very fortunate that the governor's office has included the full amount of what we need in her budget. And we're just basically carrying that message to the lawmakers that we hope that they'll support that as well.
Yeah, I think
like Jill's done a great job of a one-page flyer for the early intervention request. And anyone that wants a copy of that can reach out to us, and we'll be happy to share that with them electronically.
Is that something that we would be able to put in the chat?
Absolutely. Yes, I can send that to you, a link for downloading the flyer. Absolutely.
Yeah, we're going to put a few links in there, rehab.alabama.gov, Alabama legislator, and we'd like to get that flyer in the chat so people watching can click on that and learn a little bit more. And anybody watching in the future, take this time to reach out to your legislators. You guys heard it here. What we can do to help ADRS, Commissioner Birchoff, and Mrs. West is reaching out to our representatives through social media. You don't have to go down to the Hill, but reinforce what they're saying on a personal level. And we're going to kind of wrap up here, but is there anything that we haven't talked about, or is there anything that you would like to say to individuals or family members?
Sure. I want to take a moment to echo our public health officer, Dr. Scott Harris. We are in a time of tremendous strain on families, particularly families with vulnerable children and adults. And this pandemic has taken its toll on all of us. And I want to encourage anyone that is listening to this to consider being vaccinated when your time comes and the supply is available. We need to beat this pandemic back. particularly when we have individuals with disabilities who are more medically vulnerable around us. That's who I serve. That's my entire mission. And if we're going to be successful, we've got to consider vaccinations. If people are fearful, which I understand that some are, please talk with your healthcare provider, help them give you information and facts, and just consider being vaccinated as soon as possible, so that we can reach a level and percentage of the population that we're not all having to live in fear, and we can return to some level of normalcy.
Thank you for sharing that. That's been something that I'm on a waiting list. I have my grandmother on a waiting list, my family member on a waiting list, and some of the caregivers that care for my aunt are a little reluctant to it. So I've been really encouraging them and saying, these people got it, we're going to get it. But I think that's a very powerful message. We should all be lining up to get it. And Mrs. West, is there anything that you'd like to add?
I just want to thank you again for inviting us to be on the show. We watch it. It's very good information that you share. And we thank all of our agency partners for agreeing to be on the show and spreading good information. And we want to thank too the legislature, because the folks that we've worked with have always been very supportive of ADRS, and we're glad to continue that relationship with our lawmakers.
Well, I want to thank both of you for sharing time with us this morning and being here spreading the message. And now it's our turn to kind of step up and reach out to those representatives as well. At this point, I'm going to go ahead and say goodbye to you both. If you guys want to wave to the community, and you guys have a great rest of your week.
Thank you.
And we'll go here. Okay, guys, very powerful message today. I learned a ton. Hope you guys did too. And we have a few more broadcasts coming up this week. So actually we have one tomorrow with Dr. Dan Kessler, Disability Rights and Resources. And we're going to be going live at 10 o'clock. But I can't stress enough, I'm going to be reaching out on some of the media channels that I have personally, just talking about my family member and how those services impact her. Whether it's a Twitter thing, what we keep hearing on these broadcasts about legislative advocacy is continued reaching out to your representatives. So a Twitter, a handwritten note, an email, I think a video. I think we'll do a video here for myself. But if you guys have any questions or ideas, put them in chat. I'm going to put a few links in the chat, and you guys stay classy. I will see you 10 o'clock tomorrow morning. Until then.